Hello friends! We have heard about tooth decay since we were kids. Yet our understanding of what they are, how we get them, and what we can do about them is often somewhere in the school days. Remembering those days makes me really happy.
If my teeth don't hurt, they're fine, right?
No, by the time it hurts, it's gone way too far. The nerve of the tooth is becoming annoyed and involved. So we have taken a simple filling and maybe taken it closer to a root canal or even removal of your tooth. That's why regular checkups are so important. Decay at the beginning does not necessarily hurt. In this video, I will be reminding you all about tooth decay, what it is, how it occurs, and how to treat them. And also some myths and home remedies related to tooth decay. So keep watching. Dental caries or cavities, more commonly known as tooth decay.
What is tooth decay?
Tooth decay is damage to a tooth that can happen when decay-causing bacteria feed on sugars in your mouth and make acids that attack the tooth surface, the enamel, and over time, this can lead to a small hole in a tooth called a cavity. Now let's see the stages of tooth decay to make you understand why you should act fast and when you should. Early signs of tooth decay. Dull spots may appear on a tooth that can eventually lead to a cavity. At this point, a cavity can be prevented with diligent dental care. Brushing with fluoride toothpaste, flossing, and regular dental cleanings can prevent it from becoming a full-blown cavity. Once the spot becomes a hole, it is officially a cavity. The enamel has either worn away or broken below the surface, exposing the dentine underneath. Cavity at this stage usually don't exhibit painful symptoms and can be difficult to detect on your own. This is why it is important to have regular checkups with the dentist so that the cavity can be filled before more damage is caused. At this stage, the tooth has eroded the enamel and is starting to erode the dentine underneath. If you start to feel any kind of pain in your tooth, it is your tooth's way of telling you to get to the dentist as quickly as possible. Once the cavity has reached the dentine, it will start to decay more rapidly. A dentist can still repair the tooth with a filling at this stage as long as the decay hasn't gotten past the dentine. Once the decay has eaten through the dentine, the only thing left is the pulp. Exposure of the pulp is extremely painful and hard to miss. The bacteria in your mouth can infect the pulp, causing the blood vessels and nerves to die. This is very serious and can only be fixed with a root canal treatment. Finally, an abscess occurs when the pulp is infected by the bacteria in your mouth. The bones surrounding the tooth can also become infected and severe pain and swelling are common. An abscess causes serious infections. If you have allowed your teeth to this point, a root canal or possibly even an extraction will be necessary. Cavities go through many stages and give many warning signs before progressing to the last stage. Now that you know the stages and what to expect, you can take the necessary steps without fear of the unknown. The best way to prevent cavities is with good oral hygiene and regular visits to your dentist. Now let's see some myths. Brown spots are a cavity. Not necessary. A lot of time it is just stains. At times it can even be hardened calculus that has discolored, which may look as though they are cavities, but it is not a cavity. Now, can an infected tooth where the nerve or the pulp of the tooth is infected or necrotic, that is dyed, be revived or turned back to normal? The answer is a big no. Some people think that it can. They try out new home remedies which they feel can cure a decayed tooth. The pain fades or disappears, or the swelling fades away. The symptoms have stopped, so you feel that you are cured. But that is not the case. There is still a chronic asymptomatic infection going on. That means the infection is still there and is spreading further, and it is still dangerous. If pain goes away, it does not mean that your decayed tooth has disappeared too. Please do not get misled by such sort of remedies. These remedies may help you from relieving your pain, but does not cure tooth decay. You have to get checked by your dentist. The only home remedies that you can follow, which will be best, is to brush your teeth twice daily, floss once a day, eat healthy food like milk, yogurt, cheese, fruits and vegetables like carrots and spinach. By following all this and visiting your dentist once in every 6 months or at least once a year can prevent tooth decay. I hope this video gave you a good idea about tooth decay and what you should and should not do to prevent it. Do like, share, and most importantly, do subscribe to my channel for more fun learning videos about your teeth. Meet you all next Saturday with a new episode targeting mainly for all moms to be. Till then, stay safe, stay happy. Bye.